حلقة النهاردة مش معانا في الاستوديو، دي معانا من الولايات المتحدة الأمريكية. ولأننا مهتمين بكل ما هو جديد في الطب، احنا معانا النهاردة الأستاذة الدكتورة كولين كرافت، أستاذ طب الأطفال جامعة جنوب كاليفورنيا وفي مستشفى الأطفال في لوس أنجلوس في الولايات المتحدة الأمريكية. سنة 2018 عملت كرئيس للأكاديمية الأمريكية لطب الأطفال The American Academy of Pediatrics. Welcome, Colleen. How are you?
Good morning from here. I'm fine.
Wow, good morning. You're in the U.S. Welcome. It's a pleasure to have you with us in Dr. Health program on CBC channel.
I'm really glad to be invited to be a guest. Thank you.
Thank you very much for accepting the invitation. And today we're going to discuss the new technologies in diagnosis and treatment of pediatric disorders. So can I start by asking you, what are some of the gaps in pediatric care that we can address using new technologies?
Sure. So in pediatric medicine, the more we learn about diseases, the more we have gaps in actually being able to diagnose kids. We have gaps in the right treatments for them. And then self-management. How do we help our families do the right things to help their child who has a particular disease or condition? All of these things can be helped with technology.
Yeah. And what's the artificial intelligence? It's becoming very popular nowadays, as we all know. So how does the artificial intelligence intersect with these new technologies?
So many of my patients are scared when they hear about something that has anything to do with artificial intelligence, but it's really a pretty simple concept. Suppose you have a box of toys, and your task is to separate all the red toys from all the toys that are not red. Well, artificial intelligence is putting together a program that figures out the rules between what are the red toys, what are the not red toys. And these are things that would require your intelligence to figure out. But with AI, it can scan these items and separate them immediately.
Yeah.
So that's the basics behind artificial intelligence. There's also something called machine learning, which is where the more data, the more red you show this algorithm, the better it is from figuring out red and not red. So machine learning really helps to program all of these different devices so that they can do things like show you when a glucose is high, or show you when a heart rate is high, or give a diagnosis of a child who might have a genetic syndrome.
Yeah, and can we say that artificial intelligence saves a lot of time? It's trying to imitate humans, but maybe it saves our time?
It does. It saves our time, and it can help to make decisions quickly that it takes us a lot of time to do, so that when we understand what's at that decision point, we as humans who have real intelligence and real relationships with patients can make the right clinical decisions.
Yeah, and can you give us some examples? You passed quickly and said glucose monitoring and others. What are the clinical applications that we can use the technology to diagnose some pediatric conditions to help the doctors?
So one of the most widespread ones is actually in your specialty, in pediatric endocrinology.
Yeah, indeed.
We have something called, yes, continuous glucose monitoring. So artificial intelligence can read signs of when glucose is high, when glucose is low, and it can actually be programmed into a device so that a child does not have to do finger sticks 7 or 8 times a day.
Yeah.
That you can tell where that child's glucose is.
Yeah, and does it apply to the insulin pump, for example? Can we utilize artificial intelligence in the insulin pump for diabetic children?
Absolutely. So the insulin pump can use that information and know when it actually has to dispense insulin and when it does not have to.
Yeah. And what about the treatment? We spoke about the diagnosis, and you gave a very good example of the insulin pump for the treatment. Are there any other applications for various therapies utilizing AI for children?
So it's important because you don't want to give too much insulin to a child and make their glucose get too low, but you want to be able to control the high glucose because that's going to be part of what helps their long-term outcomes. So being able to specifically treat those high glucoses are really going to be important. And that again is where this technology helps us figure out where that child's glucose is, how much medicine to give them, all part of that child's therapy.
Yeah, that's true. So yes, AI, we have to face it. It's entering into the medicine, into the applications, into the diagnosis and treatment of children. But can I ask you, Colleen, do we need to be a little bit careful when using AI? We as humans cannot rely 100% on the AI. What do you think of this?
So that is absolutely correct. Everything that is done and processed through AI really needs to have a doctor take a look at in terms of what is clinically accurate. Because one of the real problems with AI is that, and machine learning, is that the algorithms are based on the information that is presented to it. So if there is wrong information presented, then we have wrong algorithms and misinformation. A great example of that is in social media right now. So if somebody goes onto an Instagram platform and says, well, this vaccine caused me to lose all of my hair, that becomes data that's put into the algorithm. So when a parent very innocently asks, what are the side effects of vaccines, they're going to get things like it makes you lose your hair, it makes you not grow, it makes you do other things. That is misinformation because artificial intelligence and machine learning augment the data that's in there.
Yeah.
So we have to be very careful.
Yeah.
So
it's a helpful tool, but we still have to use our brains as humans. I think so. This is what you want to say, yeah?
Absolutely. And in even a diagnostic device. So I use one that is called Canvas DX that actually takes in information from parents, from a physician, and from a child through videos to make the diagnosis of autism. But the device can't do it by itself. It can't do that without a history, without a physical exam, without knowing how that child is performing in the home, in school, and in other places. So all of these things help us with the time it takes to make a decision, but you still need to trust your doctor to make that decision and to make the right applications of what needs to happen next to treat your child.
Yeah, I totally agree with you. Thank you very much, Colleen, for this really interesting discussion and very exciting topic. And thank you for being with us in Dr. Health program.
You're welcome.
Thank you very much. ولسه كلامنا مستمر مع دكتور كولين كرافت، هتبقى معانا في حلقات تانية، ولسه مكملين كلامنا في دكتور هيلث. عندنا فقرات تانية كتير